That's right.
Before I start, I would like to say a couple of things. First, that I'm naive to coffee. My first cappuccino I have drunk here. My first coffee at all in my life I have drunk here. So, and I drank it with pleasure. So thank you very much.
With coffee. But this is the first, I have to say that this is the first she drinks, but she has worked a lot with coffee.
Yeah. That was the second thing. My second concept is that I'm a preclinical researcher, and this is the first study, the first presentation in which you are going to see some preclinical studies, results from rats. I hope you don't run away. Okay, so my talk is coffee components and byproducts for brain-gut axis. What is the thing? Here. Sorry, didn't notice it. Okay, so for the brain-gut axis health, we have just seen that there are some effects that occur in the brain and some effects that occur in the gastrointestinal tract or the gastrointestinal system, and I'm very interested in that. But I'm going to talk today about that interaction. There are some disorders, some diseases that affect particularly that interaction, and this is what I'm interested in most. So I'm going to talk first about what the brain-gut axis is. And the brain-gut axis is the bidirectional connection between the brain and the gut, which is due to the participation of innervation to hormones that are released from one organ or the other organ and may act on the other organ as well, and the immune system components and also the microbiota metabolites. So this is the brain-gut axis interaction that can be altered by many factors, including age, sex, circadian cycle, exercise, disorders affecting the gastrointestinal tract or the brain, or both, the brain-gut axis disorders, like irritable bowel syndrome, this is the one we are going to talk about today, or systemic diseases, or drugs, or surgery, or the diet. But I have titled this slide as Coffee and the BGA. When I first met Lolly a number of years ago, we started to talk about what to do together. And we thought that it was a good idea to start with reviewing the literature about the topic. And we didn't find that much. We found several studies working on the brain, several studies working on the gastrointestinal tract, but not on the axis. And 4 years later, in this other review, recently published, we have more or less the same facts. Here you can see that coffee may cause effects on the brain and also on the gastrointestinal tract. Not only the coffee, but also components in the coffee, like polyphenols, melanoidins, and caffeine, may cause effects in either one or the other system. Together, we have been working on different components and byproducts of coffee. We have been working on spent coffee grounds, melanoidins from coffee silver skin, and instant cascara, which I will call from now onwards IC. And I don't have the time to go through all the details, but just I would like to tell you that spent coffee grounds and melanoidins caused in our rats an acceleration of GI transit, probably because of their fiber effect. But now I would like to talk to you a little bit more about instant cascara, IC, which is a beverage. And here you have the composition of cascara, the IC powdered extract, and also the instant cascara beverage when we use the powdered extract at 10 milligrams per milliliter. I'm not going to go into the details. I'm not the expert on this. Sorry, Lolly is. You can ask her later if you want. But I would like to say that there are nutritional claims that have been made for the powdered extract, and probably this works also for the beverage, like low in fat, without added sugars, high in fiber, source of potassium and magnesium, low in caffeine content. And my question, this was what interested me, is what are IC beverage effects on the healthy and disordered BGA, brain-gut axis? So let's talk a little bit about what the BGA disorders are, and we will concentrate on irritable bowel syndrome. According to Rome 4 criteria, there are many different functional gastrointestinal disorders or disorders of the brain-gut axis. Among them, IBS is the one we are interested in this project. And it can be described, it is the kind of problem that have many patients with abdominal pain and either constipation or diarrhea or mixed bowel habits. And normally they have also problems of anxiety and or depression. It affects 10% of the population. That means there are a lot of people having problems of this type. It is also sex-biased. This means that for one male, there are 2 females having this problem. Furthermore, in males, the predominance is for diarrhea, and in women, the predominance is for constipation. It is a functional disorder. This means that there is no inflammatory process in the gut, not evident. It is complex and multifactorial. It is difficult to manage. And we work in animals, so is there any animal model for this problem? Yes, we can use animal models for this problem. And what do we do if we want to work with animal models? First, we have to be able to simulate the actual symptoms of the patient. So we are going to study visceral pain. We are going to study gastrointestinal tract motility and the consistency of feces and so on. And we are going to study also how they behave in behavioral tests, typical for these kind of studies. And how can we mimic irritable bowel syndrome? We have to think of the cause of the problem, and there's no one cause. So the first thing we can do is to cause the problem in the gastrointestinal tract by inducing an infection or inflammation, and then we can study later on what happens there, and we will see that there is irritable bowel syndrome with diarrhea. We can also induce irritable bowel syndrome with diarrhea if we induce psychological stress to the animals at different moments in their life. And what about IBS with constipation? This is not so easy, but we found a way to induce kind of irritable bowel syndrome with constipation with diet. And in this one, we have tested instant cascara, and this, what you see there, is the bottle we use for the animals. So the first thing we did was to study if IC was safe for the BGA, and we studied then the effects of IC in healthy rats. This is our protocol. I'm not going to go into many details, but we first studied rats under standard diet, and we exposed them to either water, plain water, or the icy beverage. We did an acute and chronic study, and I will show you only the chronic study results, just a summary of them. So we performed first a study of gastrointestinal motility using X-rays, which is a non-invasive method, which is very convenient for our studies. And as you can see here, we compared males and females, and we studied the effects of IC in both males and females. Males are in blue, females are in red. And there wasn't any effect induced by IC. The only effects that you can see, the difference that you can see is because of the sex. So gastrointestinal motility is not affected by IC, at least not with this method. Then we took colonic samples and we studied them in vitro. And we studied different parameters. Here I'm going to show you the most important one that was changed. Also by sex, as you can see on the left in the graph, there is an increase in the response in females, again in red. And at the other side, on the right, you can see how these responses were increased in IC exposed females when we did the same experiment in the presence of atropine, which produces a blockage of muscarinic receptors, which are in the gut, okay? Okay, so the last one here was visceral sensitivity. What did we find? Well, actually also in females exposed to IC, which is the continuous line there, we found an increase in the effect of the response to mechanical colonic stimulation. This image here is a histology study that demonstrates that there is no inflammation in the colon because this is a functional disease, not an organic one. However, we found that, again, in females, there is an increase in macrophages in the distal colon. It is slight, but it is significant, and maybe it is correlated with the changes in colonic in vitro activity and in visceral pain. So we can say that IC did not cause any significant functional gastrointestinal effect in healthy males, but slightly increased colonic contractility and sensitivity in healthy females associated with an increase in macrophage count in the distal colon. Then we think about, okay, let's try in the model of IBS with constipation. And we did this. The first thing I have to say is that when we work in the laboratory with a standard diet, this is a cereal-based diet, and it doesn't have a fixed composition from batch to batch. So we thought maybe we could try purified diets which have a fixed ingredient composition, and it doesn't change from batch to batch. So it would be more reproducible. Here you have the composition of both diets, IN93M and IN93G. The difference between the two is that M is used normally for maintenance of adult animals, whereas G, it is used for gestation and growing animals. However, we have used it for adult animals as well, because, as you can see here, it has more fat and it has more caloric content. It is a little bit moderately hypercaloric, and this is what we wanted to see, if there was a problem with the brain-gut axis in there. Okay, so 6 weeks after IN93G compared with the standard diet, non-purified, what we saw, again, males in blue and females in red, is that in the visceral sensitivity test, if you look at the graph to the right, you will see that there is an increase in the duration of the abdominal contractions only in males exposed to this IN93G diet. In the whole board test, which measures, for example, mild anxiety, we saw that there is an increase in time the males were not moving, like freezing, because they were anxious, and a decrease in the number of feces. Probably the diet was causing this problem. So we believe that this protocol makes the males with IN93G makes them to have a kind of IBS with constipation. The symptoms are there. However, we did another study, the X-ray study, and we saw that the cecum size was, which is very big in the rats, was reduced in both sexes, in both males and females, which probably means that there are differences after ingesting this diet in the microbiota composition, for example. But we have still to study this. So another step in this was to change the standard diet to the two purified diets. IN93M is more similar to the standard diet in terms of caloric content and fat, and the other one is, as you have seen before. And only 3 weeks made this cecum in both males and females to be smaller again. So there are similar changes just after 3 weeks of ingesting these purified diets, both of them, which is very curious. So the last thing we did was to study what happened with IC, with instant cascara, in this model of IBS-C. So we changed the standard diet to purified diets. We followed the same protocol, more or less. I'm going to show you only some results of the chronic study and only in males. And regarding visceral sensitivity, we found a little bit of difference there, but I don't think it's clinically relevant. In the cecum size, we didn't see that IC did anything in the X-ray study. However, at necropsy, when we killed the animals, we found that IC slightly, non-significantly, but slightly increased the cecum size. It is important to say that transit in the colorectum was increased in both diets by IC, and this we could see also in the number of fecal pellets only for the I93G diet. And again, in the whole board test, in which we can see the fecal pellets expulsion, we can see that there was an increase, non-significant, but it is consistent with the rest of the results after IC with both diets. And we didn't see anything in another behavioral study, which is the splash test that measures depression. So, IC improves transit and defecation in the IBS with constipation male rat model, and the conclusions of our studies are that the preclinical research indicates that at alimentary doses, coffee and coffee components and byproducts are safe for the brain gut axis health with minor effects on control animals. Instant cascara may increase colonic sensitivity and contractility in control females, which is interesting, and may improve some IBS with constipation-like symptoms caused in male rats by a purified diet, which is also very interesting. However, I must say that this is the key conclusion. The effects of coffee components and byproducts need to be more deeply evaluated in both relevant animal models of brain gut axis disorders and in the clinical trials, because as I said before, there are not many studies on this. So I would like to thank my research team. We are called New Gut, and we have a, what happened? It's disappeared. Anyway, I don't know why it's disappeared, but I wanted to say that our logo is a big smile, a big nice smile connecting the brain and the gut. And I wanted to thank also my international collaborators who helped with purified diets, my national collaborator, which is Loli in this case, Professor Del Castillo, and also our funding bodies. So thank you very much for your attention.
Thank you.